This is a tutorial on your clinical diary. The first sheet of the clinical diary aims to be a summary of the kinds of conditions and techniques that you've used. It's useful when you come to writing a CV or applying for jobs to have this information. It's also nice to summarise at the end of a placement exactly what you've achieved. But you need to maintain the record throughout or you will forget things. The main part of the clinical diary is the patient log. This is the format that we ask you to complete. Diagnosis or presenting complaint and relevant comorbidities, risk analysis, problem list, this is physiotherapy problems, any problems that aren't really physiotherapy problems but impact on treatment come under risk, and then the summary of treatments and outcomes, and this should be linked to your problems so that we can see your clinical reasoning. The purpose of the patient log is to develop your clinical reasoning skills. If you're struggling to identify the patient's problems, it may be that that gives you a clue that you need to think more about your assessment, and needing to link the treatment with the problem list will help you to make sure that you're treating your patient holistically, because you'll be able to see if you've treated and addressed all of their problems. The outcomes, that could be an outcome measure, or it could be your achievement, the patient's achievement against participation and activity goals. It is best if you identify your problems in alignment with the ICF framework. So what resources do we have to help you with this? Let's show you the clinical guidelines. So these are the portfolio guidelines, and you can see that the clinical diary has been completed with a description of roles and responsibilities, patients, techniques, and so on included. We've included a couple of examples from each kind of paper as to how this might be completed. So you've got 455, musculoskeletal, 456, rehab, and 457, which is tertiary. Here you can see there's impairment goals and functional goals, and there's a participation goal. So impairments, functions, participation, they're numbered, and you can see that the patient had 6 sessions and which elements were treated. So 1 and 2 were treated with McKenzie extensions, and 3 was treated with 2 different techniques. And you can see the outcome. It doesn't need to be that you're writing down every single session with the patient, but this is a summary. So again, the problems are numbered, and so that we can clearly link. And if you're struggling to do this, and if you don't show this to your supervisor or your clinical educator, then it can really help to communicate with them your clinical reasoning, your clinical thinking. And if you're struggling with it, it can really help you to understand where you need to do some more learning, or what your holes are. So this is a really, really useful tool. It's only useful if you do it contemporaneously. That means as you go. It's something that you can share, as I said, with your supervisor or your clinical educator. Here's one for neurology. And so again, we've got impairments that relate to things that is being treated, and how they're being treated, 1, 2, and 3, 1, 2, and 3. We've got functional problems and participation problems, and the outcomes relate to these. And again, same thing for, so with surgery for the risks. So it may be that in some of these we have falls risks. So you might have done a falls risk assessment, including, the age, and then polypharmacy, and all of those multiple things that can impact on somebody's falls risk. And you may have critiqued that. Here, we've done a similar thing for their risk of post-op pulmonary complications. So you've broken down that risk and said whether they're high or medium or low risk. for having post-operative complications after surgery. This could also be yellow flags as to why somebody might struggle to participate in rehab, or other health concerns that impact on rehab or how you deliver rehab. So things like not speaking English might impact on how long the sessions take, or the efficacy, or the fact that you limited your education or something like that. Again, we've identified problems, and we've numbered them, and we're linking them. So to summarise, Clinical Diary is an excellent tool for guiding your clinical reasoning and for making sure that you're treating a patient holistically when it's done well. It is something you may need help with, and we're here to help.